current statistics related to the COVID-19 disease, which is caused by the SARS-CoV-2 virus, shows that it affects predominantly men. As a matter of fact, this current statistics suggest that 58% of the people that come down with this disease are men. The number of cases increases progressively by gender in favor of male subjects to the age group of 60 to 69, 66.6%, and in 70 to 79, 66.1%. That's pretty common knowledge. Older people tend to be at greater risk for COVID-19 disease simply because they often have what they call comorbidities, which are other diseases, heart disease, pulmonary disease, pre-existing disease that makes them particularly susceptible to some of the more serious consequences of COVID-19. This isn't to say, however, that every person who's, let's say, over the age of 60 is going to die if they get COVID-19. Quite a few. In fact, there was one case, there was a 102-year-old woman who actually survived COVID-19. It all depends on your general state of health and particularly the state of your immune system. The reason why older people generally tend to be more prone to getting this disease is because they have depressed immune systems. Your immune system tends to go down or decline in, let's say, potency as you age. But again, if you live a healthy lifestyle, if you eat right, if you follow good nutritional practices, if you exercise, it doesn't necessarily mean that you have depressed immunity past a certain age. There are a lot of healthy people in their 70s and 80s that are just as healthy and have just as good immune system as people, let's say, in their 40s. So that the general idea that if you're over, let's say, 60, that you're going to die if you get it is just utter garbage. It again depends on the individual. But however, one thing that is known, according to the current statistics, is that men do get the disease easier than women. And this now, of course, there are many differences between men and women, but the first thing that comes to mind when you're comparing men and women is testosterone. Men generally, depending on which textbook you read, have anywhere from 10 to 20 times more testosterone. Usually it's 10 times. Men produce about 10 times more testosterone than women. The initial clinical manifestation of the COVID-19 disease is pneumonia. You can get a very serious type of pneumonia, although gastrointestinal symptoms and asymptomatic infections have yet to, you can also get those too. The infection can progress to severe disease with problems with breathing, chest symptoms corresponding to pneumonia in the second or third week of a symptomatic infection. In other words, after about 2-3 weeks, the disease can progress to pneumonia. Initially, you have like sore throat, you have a dry cough, you might have a loss of sense of smell, loss of sense of taste, general fatigue, really bad fatigue. And some people have serious aches all over their body. Some people have described it like their body is literally falling apart. And these are people that have never experienced this type of pain. These are all symptoms of the COVID-19. Clinical data show decreased oxygen saturation, changes visible through chest x-rays and other imaging techniques. Lymphopenia, or lack of lowering of white blood cells, appears to be common, along with an increase of inflammatory markers such as C-reactive protein and pro-inflammatory cytokines, which play a huge role in the most serious consequence of the disease, which is called cytokine storm. Cytokines are proteins manufactured by immune cells. Normally they're protective. However, when they're produced in abundance, they can cause an autoimmune reaction where your body basically breaks down your own tissues. In this case, it would be lung tissue. So, the alveoli, the breathing sacs of the lung, start to be attacked by these cytokines, and that makes you, that forces you to go on a ventilator just to be able to breathe. And I think it's something like 8 out of 10 people, I don't remember the exact figure, but something like 8 out of 10 people who progress to the ventilator stage of COVID-19 die. Unfortunately, when you are to the point where you have to be put on a ventilator, you're in big trouble. So what is the possible relationship of testosterone to COVID-19? There actually is a relationship between both low testosterone and high testosterone. Either one of them could be a problem in relation to COVID-19. Now, how could that be? Well, it turns out that that low plasma testosterone levels in men are associated with some of the diseases that increase the risk of COVID-19. For example, obesity, diabetes, and obstructive sleep apnea. All of them have been associated with increased risk of COVID-19, and all of them are associated with low testosterone levels in men. Hypogonadism or low testosterone is associated with a prevalence of between 22 and 69% for obstructive pulmonary disease, such as emphysema and asthma, that type of thing. It's also increased with when you have low testosterone. Low testosterone levels can cause a reduction of respiratory and muscle activity and overall strength and exercise capacity. Again, the better the cardiovascular shape you're in, this is a little known fact, the better you have resistance you have against COVID-19. So, those of you listening, you want to make sure you do aerobic exercise, stay in good cardiovascular shape. That has a definite preventive effect against COVID-19 because it keeps your keeps your lungs strong, and it increases your oxygen delivery, which is very important when it comes to COVID-19. A randomized controlled trial reported an improvement in peak oxygen consumption in men receiving testosterone replacement therapy. SARS-CoV-2, that's the virus that causes COVID-19. It infects lung alveolar epithelial cells. Those are the cells that line what they call the alveoli, which are the portion of the lungs that exchange oxygen and carbon dioxide. COVID affects lung alveolar epithelial cells, using it as an entry receptor. The SARS gets in the body through interacting with a receptor called the angiotensin converting enzyme 2 receptor. Angiotensin converting enzyme 2, or ACE2, it plays a role in lung protection, and therefore viral binding to this receptor may regulate a lung protective pathway. In other words, it also activates a protective pathway. Interestingly, studies show that ACE2 is a constitutive product of adult Leydig cells, thus implying a role in testosterone. In other words, this same receptor, the ACE2 receptor, is also found in testicular cells that produce testosterone, the Leydig cells, and this suggests a possible involvement of the testicle in COVID-19 infected patients, a factor which may affect testosterone secretion. Now, I mentioned those pro-inflammatory cytokines, which are, again, proteins produced by immune cells that cause tremendous inflammation, which can protect you under certain conditions, but if they get out of hand, what's called a cytokine storm, that is the thing that causes people to go on respirators. Pro-inflammatory cytokines have a central role in the progression of COVID-19. Reduction of cytokine activity and or receptors can be useful for treatment in this context. Testosterone may downregulate inflammation. Very important point. As a matter of fact, several studies carried out both in animals and humans showed that hypogonadism, or low testosterone, is associated with increased pro-inflammatory cytokines, the same ones that are involved in the cytokine storm that kills people with COVID-19. Testosterone treatment reduces some of these inflammatory cytokines, such as interleukin-1b, interleukin-6, and tissue necrosis factor A. So testosterone directly reduces these inflammatory cytokines, which are the real killers when it comes to COVID-19. A very interesting fact. Furthermore, the association between an increase of pro-inflammatory state and decline in testosterone is often observed in aging men and in men with stable coronary artery disease. What that means is as men get older and their testosterone levels drop, levels of inflammatory cytokines go up. And this, again, you can see the relationship why they say older people, especially older men, are more prone to COVID-19, because a lot of them have low testosterone, which means increased levels of inflammatory cytokines, which again are a major cause of the main complications of COVID-19. Based on the above consideration, the hypothesis arises that testosterone may have a role in the cascade of events leading to progression of COVID-19 infection due to cytokine storm. Suppression of ACE2 expression by inflammatory cytokines, accompanied by the decrease of androgens and estrogens of the elderly, may establish a negative correlation between ACE2 expression and COVID-19 mortality. In other words, the inflammatory cytokines interfere with the protective effect on the lungs, in the lungs of the ACE2 receptor, and that increases the risk of death. That's, now you know, the reason why older people, especially older men, are at greater risk for death to COVID-19, because a lot of them are deficient in testosterone, plus the fact that they have comorbidities like heart disease, obesity, diabetes, that thing. All of these add up to create a perfect storm, which makes them very, very prone to very serious effects should they be unfortunate enough to acquire this particular disease. At present, data on testosterone can be collected systematically. From, in other words, if values are low, use of testosterone may be considered to reduce the associated pulmonary syndrome, thus preventing progression to severe COVID-19 disease, where pro-inflammatory cytokines play a major role. Now, that's low testosterone. What about high testosterone? As opposed to what's mentioned earlier, the testosterone COVID-19 theory, this is based on the androgen receptor activation of the transcription of a transmembrane protease serine 2, exploring possible implications in risk stratification and transmission of COVID-19. Although other proteases, those are protein enzymes that were described to activate the COVID-19 spikes in vitro, only this particular protein, which is the one I mentioned, it's called TMP-RSS2, only that one is regarded as essential for the viral spread and pathogenesis in the infected host. In other words, this particular protein enzyme is needed for the SARS-CoV-2 virus to infect a person. It's actually needed. It's involved. Now, the bad part is that this particular protein enzyme is also associated with the androgen receptor, and it's been suggested to contribute to male predominance of the COVID-19 infection. Finally, TMP-RSS2 is both the most frequently altered gene in primary prostate cancer and a critical factor enabling cellular infection by SARS-CoV-2. The hyperandrogenic phenotype could explain the COVID positivity in those few young males with severe COVID-19. What does that mean? Well, what they're saying here, this is just a hypothesis. This is a theory. This, by the way, I'm reading off a new medical journal article that was published by Italian researchers in the journal Metabolism. A lot of this is hypothetical. You have to understand, but the mechanisms I discussed all are known to exist. Now, what they're saying here is people, younger men who have unusually high testosterone levels have higher levels of this TMP-RSS2, let's say, protein enzyme, which is involved in the infectability, if you want to call it, or the infection potential of the virus that causes COVID-19. So when you add it up, what does it mean? It means that if you have unusually high testosterone levels, you could be at another reason why you could be at greater risk. And since older men tend to have lower testosterone levels, this particular testosterone risk would be more applicable to younger men with unusually high testosterone levels. And it didn't say so in this article, but I'm assuming that athletes and bodybuilders who take large amounts of anabolic steroids, which make your testosterone, of course, go through the roof, will have particularly active forms of the TMP-RSS2 protein, which makes them more prone to getting COVID-19. Very interesting. In other words, again, this is theoretical, but in other words, there are drugs, for example, there are drugs that treat prostate cancer that tend to depress this particular protein. And I'm not saying that people on steroids should take this drug, because they produce more of this TMP-RSS2 protein. What I'm saying is that I'm just giving a warning out here that, if you have unusually high androgen levels, testosterone, either naturally, or I would tend to think that those with naturally high testosterone levels, even younger men, I don't think they would be at greater risk. I think the lower testosterone, because of the reasons I cited earlier, I think they would be at greater risk rather than high natural testosterone. However, the artificially high levels of testosterone produced by using high-dose anabolic steroid regimes will definitely increase this particular protein. And this particular protein, once again, activates the mechanisms that allow the virus that causes COVID-19 to get into the body. So the bottom line, the thing to remember, when you're on high dose steroids, you better be careful when you go out in public, because you basically have a kind of a, to put it in a metaphor, you have an open door in your body that's ready to let in this virus. It's ready to go. You're set up for it. So if you're taking steroids and you're walking around, my advice to you is to be very careful. Wear the mask. Don't go more than 6 feet closer to anybody. If you do train in a gym that opens up, my God, you better wipe down that equipment. You better not touch your face when you work out. You better wash your hands after every exercise, because if you're taking steroids, you're at much greater risk to get the COVID-19 because of this protein that nobody's talking about, by the way. I just discovered this myself. Nobody's talking. You're not hearing about this on the news, nothing. So, again, I'm not taking a moral stand here against using steroids. I'm not going to go on a tangent and tell you not to take steroids because you're going to get COVID-19. I'm not saying that. What I'm saying is, if you are on steroids, or even if you're on testosterone replacement therapy, and you're taking doses that put you over let's say the normal range of testosterone, you are going to be at greater risk if you happen to come across somebody who has the COVID-19 disease. If they breathe on you, sneeze on you, or if you get within 6 feet and if they're positive, and remember, 25% of the people walking around have the disease, but they don't have symptoms yet they can transmit the disease. So you could be working out in the gym next to somebody who's not coughing, has none of the symptoms, yet has the virus, has the disease. They breathe close to you, you've got it. If you're on testosterone, if you're on steroids, they breathe on you, you're going to get it because you have an open door. So this is just a friendly warning to be really careful if you're taking steroids. And again, the other thing I'd say is, if you're on low testosterone, if you have low testosterone, maybe you don't want to go on testosterone therapy for whatever reason, you also have to be really, really careful, because low testosterone, again, because of the increase in inflammatory cytokines, which cause the cytokine storm that kills people with COVID-19, you are at far greater risk of that happening when you have low testosterone. So the bottom line is, having both low testosterone and usually high testosterone increases the risk of extremely serious, possibly deadly consequences if you are, again, unlucky enough to acquire this COVID-19 virus. So that's all that's all I'm going to say about this. I thought that I should put this out right away. I just found this information just the other day. I thought it's real important because I don't hear anybody talking about this stuff. So I thought people should know about it. Anyway, if you want more information on nutrition, exercise science, anti-aging research that works, supplements that work, supplements that don't. I'm not involved with any supplement company. Ergogenic aids, hormonal therapy, women's health and fitness, various other subjects, topics. I cover a lot of topics in my Applied Metabolics newsletter. Subscribe today. It's 40 to 50 pages every month. It's appliedmetabolics.com. I have approximately, I don't even remember. I have about 45 years of professional writing experience. I was the science editor of Muscle and Fitness magazine for 10 years. I don't think anybody has been around as long as me, who's studying as long as me. No PhD or even MD can match my years of constant study and experience, and also being in the gym itself. I've learned what works and what doesn't work, and I write all of this up in my Applied Metabolics newsletter. So subscribe today, and when you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, medicine, and general health. I also have an email portal on my Applied Metabolics site. It's strictly for what is that light going on? Anyway, I think there's a UFO that just landed in my living room. Anyway, do you see that light going? I don't see it. There's nothing here. There's a light. I'm looking. There's a light going on. I don't know what it is. Oh. Uh-oh. Did I say the wrong thing here about testosterone? Anyway, so subscribe today. As I said, I have an email portal on my Applied Metabolics website. Current subscribers only can send me short questions about anything they want to know or anything they might have read in the newsletter. I don't answer unsolicited questions. However, you are welcome to You're welcome to leave comments, suggestions for future videos underneath this video. I will consider possible topics for future videos. However, I can't guarantee I will answer questions left under my video. That's about it for today. Again, I'll just say it again. I mean, this to me is really fascinating information that both high and low testosterone can affect your chances of getting this COVID-19 thing. Be careful. Take care, and you want to have the best friend. I don't know if shelters are even open now. I'm not sure if the shelters are open, with this pandemic going around. But if you know of any place to, save a dog, please do so, because they're great animals. They'll be your best friends for life. I guarantee it. So, save a dog, adopt a dog. You won't be sorry. Take care. Thanks for listening.